Hi, my name is Yasel. I'm a first year respiratory student, and today I'm going to be talking to you about full ventilatory support. So, what is full ventilatory support? In full ventilatory support, what we're doing is providing over the patient's work of breathing, their minute ventilation, and their FiO2. And then with this, we are hoping to normalize their ABG. Then, an example of a mode in the ventilator where full ventilatory support is actually being applied is assist control. So, in this mode, the ventilator is actually providing full ventilatory support to the patient, so the patient doesn't have to breathe, and if the patient does breathe, then their preset tidal volume is actually delivered to them. And then in this mode, what we're also doing is letting their ventilatory muscles rest, so the patient doesn't have to do any of the work. So some of the parameters that we set on a ventilator for when we are starting the ventilator are their tidal volume, their respiratory rate, their frequency, their sensitivity, their PEEP, and their flow. So to start off with, for the initial settings of the parameters that we would do is their tidal volume. So for their tidal volume, you would set it at 6 to 8 milliliters per kilogram or 4 to 6 milliliters per kilogram for ARDS, just as a lung protective strategy. And then for their frequency or respiratory rate, to start off at, you would set it at 12 to 16 breaths per minute or 20 to 25 breaths per minute for patients with a low tidal volume or who have ARDS. And then for the flow, we would want to set that at 40 to 80 liters per minute, and you would set the flow according to your desired I time. And then for the FiO2, we want to keep that at less than 60% just because we do want to prevent oxygen toxicity. And then for the sensitivity, we want that to be at -2 centimeters of water pressure. And then for the PEEP, we want to start off at 5 to 8 centimeters of water pressure. And just be aware that when you are in pressure control, when you do increase the PEEP, the tidal volume will actually be decreased. Thank you.